I'm Dr. Savitha, a specialist gynecologist working at the RUWAIS hospital almost for the past 3 years. First of all, I want to thank you, the RUWAIS hospital marketing team, for giving this opportunity to talk with the people here. The important topic, the cervical cancer, and about the screening test for the cervical cancer. So first I want to talk about what is cervical cancer, and the next thing I'll talk about how we can prevent it, what are the measures and what are the tests which are available to prevent the cervical cancer. So the cervical cancer is in Abu Dhabi. This is the third leading cancer in Abu Dhabi. But good thing is it is easily preventable, and I'll talk about that later, how we can prevent it. What is, first of all, cancer? Everyone, when they hear the word cancer, it is scary for them. Everyone is panic about hearing the word cancer. But after this session, hope everyone will understand about the cervical cancer and how we can prevent it easily. So what are the measures available to prevent it? And the cervix is the part which is in the lower part of the uterus, which is called the womb, neck of the womb. What is cancer is, the cancer is any abnormal growth of cells. So cervical cancer is when the abnormal growth of the cells which occurs in the cervix, which is called cervical cancer. So what are the symptoms when the people, like when the women have the cervical cancer, will have the symptoms? Usually, most of the women at the early stage of the cancer, they don't have any symptoms at all. They'll lead a normal life. They will have without any symptoms. In case if symptoms occurs, there is the symptom if they have any irregular bleeding in between the periods, if they have a bleeding, or the bleeding after the sexual intercourse, or if they have a profuse vaginal discharge. Usually the minimal vaginal discharge is normal for the female, but if they feel any abnormal vaginal discharge, which is foul smelling, which you feel that is different from your normal routine, you can have a checkup for that discharge, what it is. You can come to the hospital and discuss with the gynecologist here. And what are the causes for the cervical cancer to occur? So most of the women, 90% of the cases, it is caused by the virus, which is called human papilloma virus, which is HPV. So, for example, if anyone who will get the HPV virus, so the HPV virus, any sexually active woman, in their lifetime, more than 50% will have the HPV virus. If the HPV virus is there, whether the women will get the cervical cancer, it is wrong. Because more than 100 type of HPV viruses are there. Only few viruses, which are the high-risk viruses, like for example 16 and 18, these viruses are responsible for the most of the cervical cancer. And if the women who have the cervical, like HPV in their body, most of the time, almost 80% of the time, it will eliminate from their body because of their immune system. Automatically, it will get rid of from the body. So only a minimum number of the people, this virus will stay in their body, and after a long time, it may cause cervical cancer. So what are the risk factors? Who are all the people more prone for the cervical cancer? Most of the time, the HPV virus, how it is transmitted is sexually transmitted. So if early marriage, the women who gets marriage at early age, or who have the multiple sexual partner, and either history of sexually transmitted infection in the past, or who smoke, those are all the people high risk for getting the cervical cancer. And is there So most of the people have the question now, like whether how we can prevent it. So we have a prevention for the cervical cancer. There are two methods, two ways we can prevent the cervical cancer. First one is the easiest way is the pap smear test. So just I want to explain about what is pap smear test, how it will be done, and how easy it will be done. So, for example, like many of the patients, when they come to the clinic, it is a routine question. We ask the patients whether have you done any time pap smear. So maybe many of the people they would hear the word pap smear is for the first time. So when I ask about pap smear, 30% maybe they will know about what is pap smear. Then they'll explain. And another 70% of the people, they don't know what is pap smear. Then they'll ask, what test, doctor? What is pap smear? Then I'll tell this pap smear is a cervical cancer screening test. So immediately the reaction will be, the patient will be anxious and they think they have a cancer at present. They immediately tell, doctor, am I having a cancer? Why I have to do this test? Is it important? I don't have any symptoms. Why I have to do routinely? This is always I'm getting an answer from the patients like this only. So I just want to tell this is a screening test. Pap smear is a screening test. So what do you mean by screening test? The screening test is the test you can do the test to find out before the disease occurs. That means before the cervical cancer changes occurs in the cervix, we can detect. So that is the main advantage of the screening test. For example, like most of the people you want to find out whether you have a diabetes or not. So you want to do your sugar test. So or you want to do whether you have a cholesterol. You want to do the lipid profile. These tests you are doing routinely, maybe even more frequently. Some people they want to do every 6 months to find out whether they have a diabetes or not. The same way, this is also the test which can detect earliest, before cancer occurs. So we'll come to know any small changes in the cervix at the very, very early stage. Almost we can detect the before occurring cancer 10 years before cancer occurs. So that is the very, very important part of this test. So no one should be frightened to do this test. So routinely, I just want to tell like when it has to be done, who all it has to be done. All the women sexually active from the age of 21 years until 65 years. If the test comes normal, then they have to repeat every 3 years. And how the test will be done, it is a simple test. It can be done in the OPD procedure. Like a patient can come to the OPD, it will take only few minutes. That it is like a swab. It will be taken from the cervix, that is the neck of the womb. The sample is taken and sent for the laboratory to check any abnormal changes in the cervix. It is very, very easy. It's maybe little discomfort, but you don't have any pain or anything. The test will finish within less than 5 minutes only. It's very easy. So, and if the result comes like if it is normal, then the patient can repeat the test every 3 years routinely. And if the results comes, any changes, any abnormal changes is there, then this is also, it is not scary. Like if any abnormal changes, anything is there, then we need to do another test that is called the HPV, whether the women have the high risk HPV, with the high risk HPV, whether they have. So if it is there, then the another next step will be the colposcopy. That is, the colposcopy is like an instrument which magnify, like it has a magnifying lens. So we'll have a closer look into the cervix and look at any abnormal changes are there or not. And so the colposcopy is also available in RUWAIS hospital. Here it is available, so you can very well go about that. And so hereafter, no one should be frightened of doing the pap smear test. This is just the screening test. if you are doing the pap smear, don't think like you have a cancer, that's the reason we are doing the test. Not like that. It is routinely to be done for all the females whenever they are sexually active after every 3 years. So this is one way of preventing the cervical cancer. And the next one is the vaccines. The vaccines which are available, two types of vaccines are available. In our RUWAIS hospital, we have the vaccine called Cervarix, which is which will prevent the HPV virus type 16 and 18, which is the most common cause for the cervical cancer. So the vaccine can be given from the age of 9 years until 26 years. So ideal age is around 11 to 12 years. Here in Abu Dhabi, this is a good thing. Like in the school itself, the children are getting the vaccination as a routine immunization schedule. So who are all the people? It is actually better to take the vaccine before before marriage than before sexually active. So the effect will be more. But even the people after the marriage and even sexually active can also take the vaccine until 26 years of the age. So how many doses the vaccine can be given? The vaccine usually the 2 doses. First dose and the second one is after 6 months if it is taken less than 15 years of the age. If the vaccine is taken after 15 years of the age, the women need 3 doses of vaccines. That is first dose and again after 1 month. Then again the third dose will be after 6 months. So this is the vaccine schedule. So the vaccine is available in RUWAIS hospital. If anyone wants also, vaccine can be taken. And for the pap smear, you can come to the OPD if it is a routine screening. So you want to do for the blood test to check your sugar like that only. This is also a routine screening test. You can do every 3 years. The advantage in the Western countries are they have a reminder, and the healthcare system, they will send a mail or they'll send a letter to the patient for the reminding about that pap smear. But here it is not available. It is your responsibility at least to come to the hospital to take the pap smear because it has more advantage. This is the only cancer which can be easily preventable at very, very, very early stage. Because some abnormal changes occurs in the cervix, then after that, it might take almost 10 years to develop the cancer. So we are detecting the cervical cancer changes 10 years earlier, at the beginning, like 10 years before the cancer develops. So the prevention is always better than the cure. So take this opportunity, and if you have any doubt, if you feel any doubt, you can come to the hospital to have a consultation and to clarify whatever the doubts you have. Once again, I'm thankful for the marketing team and the RUWAIS hospital for giving this opportunity to talk about the very, very important topic for the women. Okay. If you have any queries, you can ask.
Thank you very much, Doctor.
Welcome.
We have a few questions.
Yes, sure.
Number 1, how can we lower the risk of getting cervical cancer?
Yeah, that's what I explained. The cervical cancer, most of the time it is due to the human papilloma virus infection, which is sexually transmitted. So when using the condoms, and if the women smoke or anything, to reducing the smoking, and also routinely doing the pap smear, it will help for them to detect the cancer at the early stage.
Okay, we have another question asking about if the test is painful.
It is not at all painful. It is just it'll like mild discomfort. Yeah, they will have, but it is not painful. It will take at least minimum 1 minute or 2 minutes. That's few seconds. We'll finish the test.
Great. And the minimum age to start screening?
It is 21 years.
21.
If the woman is sexually active, 21 years. Whenever.
And do you recommend any type of food that might also fight against cervical cancer?
No, till now there is no food which is related for the cervical cancer, and also no study showing any food which reduces cervical cancer.
And you mentioned the vaccines.
Yes.
Any side effects for the vaccines?
No, the vaccine usually doesn't have any side effects. If at all, some side effects, it will be like mild pain or some burning sensation. This is the one usual side effect they have.
Okay. We have a question asking about the cost for the screening as well as for the vaccines.
Yeah, the screening test, the pap smear, is covered under insurance. For the vaccine, it is not covered under insurance. For one shot, it might take around 400 dirhams.
400.
Yes.
And symptoms of cervical cancer.
Symptoms, as I mentioned, sometimes they will have irregular bleeding. If you have a bleeding in between your periods, or if you have a bleeding after the sexual intercourse, or if you have any abnormal vaginal discharge which is smelling bad, or profuse vaginal discharge, this is the most common symptoms.
And you mentioned it has to be done routinely every 3 years.
Yes, it's every 3 years if it is normal. If any changes, abnormal changes we find, then we'll advise accordingly. Either maybe they might need yearly ones, or because if any abnormal changes we find, then the next step is the colposcopy. The colposcopy is another test that is called like the lens, magnified lens is there. So we look into the cervix in a still closer look to see any abnormal changes. Then we'll take the biopsy from that and we'll send for the test. So the colposcopy also now it's available in RUWAIS hospital. That is a good thing here.
Very good. And someone is asking about the treatment of cervical cancer.
Yeah, the treatment of the cervical cancer, it depends on the stage. If we detect in the early stage, it is like if any abnormal changes which is detected in the early stage, there is a initial treatment will be the laser and removal of the part of the cervix. And it depends on the stage. If it's early stage, it's always curable and treatable.
I think, Doctor, this was great. Thank you very much. Very informative session.
Thank you,
and thank you for your time.
Yeah, thank you so much. Some other question.
Thank you for our followers.
What are the alternative cervical cancer screening options? The pap smear is the only option, like no other alternative screening option for the cervical cancer. The pap smear is the only test available as of now. Okay, thank you so much.
Thank you, Doctor.
Yeah.